Welcome, everyone. Thank you for joining us today. If you are watching live, if not, thank you for watching this after the fact. I think we've got a lot in store for us at OCD Institute of Texas today. We have a wonderful guest that's here, Sean McCartney, to share about his personal journey with OCD, navigating the ups and downs of living life without treatment and then engaging in good treatment, and then living in a place where he is embracing every aspect of life and freedom. And so, Sean, we're so excited that you were able to join us today. Thanks for being here.
Yeah, I'm so excited to be here. Thank you guys for having me.
Perfect. Well, just so you guys know, you can add questions in the live Q&A portion. We really welcome that for those of you that are joining live. Sean and I are going to start by diving into his story, me asking him some questions. I'm Callie, a clinician here at OCD Institute of Texas. I should have said that from the beginning, who does a lot of our business development and outreach and helps with these webinars. So I'm excited. I know a little bit about Sean's story, but never really heard it from start to finish. So
Yeah.
as we jump in, if you guys want clarification or questions answered, please make sure to just drop those into the chat and I will get to the live questions after we get going. Sean, anything from you before we get started?
Nope, all sounds good to me.
All right. Well, if you could start by just telling us a little bit about yourself now, what you're doing these days, what you're up to, before we dive into history of your OCD journey.
Yeah, so I think I'm about, geez, I can't remember if it's 3 or 4 years outside of treatment now. Life looks a lot different. I'm 23 years old now. I live out in Houston, Texas. Wasn't originally from there, but decided after treatment to go to school out there. So I'm currently heading into my senior year at the
Woo!
University of Houston.
I can't believe
Um,
you're in your senior year.
Yeah, it's crazy. Time flies. It's a little scary at times, but yep. So heading into my senior year, majoring in psychology, um, starting to look grad school options. So navigating that process now, but that's the school side of things. And then also working, I actually work as at a pickleball facility as a pickleball instructor. Always had a passion for sports, but kind of found pickleball after treatment and have been pretty addicted ever since.
Nice, nice. Did you also do some research in OCD at some point? I feel like I remembered us talking about that.
Yeah, so I worked a few semesters at BCM in Dr. Eric Storch's lab, working on some studies about OCD and anxiety. Um, have taken like semesters on and off, just depending on my school workload. But yeah, I think I'll be doing some work this fall in the lab again.
And then on top of that, I see you all over advocacy for OCD treatment. Just Sean's an amazing individual who talks to a lot of families who are considering treatment, individuals, just raising awareness on what evidence-based work looks like. We also love Eric Storch's lab. They have an
Mhm.
OCD program, outpatient program in Houston, as well as do a lot of research. So okay, well, let's dive into some of your treatment history, your journey with OCD. Maybe just start telling us when was OCD first prevalent for you? What did it look like? And when did you first notice something was off?
Yeah, so it's a little difficult to say. I think I've always was just like a more anxious person, like even as a young kid, like reflecting back. I was very like functional, did well academically, socially, and like out in public, I was able to kind of hold it together. But if you were to like ask my parents, they would always tell you there was kind of something up. They just couldn't really put their finger on it. Um, so for most of my childhood, like I was okay, able to function pretty well. But when I reflect, there's definitely some symptoms. And I'm looking back now, I'm like, oh, that was OCD. And the biggest thing for me was like being away from my family, um, and feeling like a fear of being separated from them or something happening to them. And this was especially prevalent like at nighttime. Um, so I really struggled to like sleep as a kid growing up because I'd be kept up at night by intrusive thoughts of something happening to my family members or me during the middle of the night and me being separated from them or something bad happening to them. And so
Did
I
those compulsions
engaged
look like asking them a lot of reassurance or
a lot of reassurance, like even a lot of like lock checking, like even as a young kid. And then a lot of like unable to like sleep alone. So like I would like go sleep on the floor of my parents' room or go sleep in one of my siblings' room. Um, so that's what that kind of looked like as a young age.
yeah.
Um, but was still very functional, especially like outside the house. Um, and it wouldn't really start to get bad until I kind of hit middle school.
And what did that
Um,
in middle school?
yeah, so middle school, it took a kind of a weird turn. Um, And obviously, as kids start to hit like puberty and all that and start to show like interest in one another, like it really latched on to a lot of like sexual intrusive thoughts and like sexual orientation intrusive thoughts. Um, and so that was really hard in middle school because I just like didn't really know what was happening. And obviously, that's a big transition just in general, like puberty and middle school and things like that. But so there's just a lot of ruminating on it
Yeah.
um, in my mind throughout middle school. Um, but like even then, I was still highly functional. Um,
When you
and
bring up a good point that I think sometimes people think sexual intrusive thoughts, oh, that can't happen for individuals unless they're adults, when in reality, like a kid can not even know what sexual intrusive thoughts are and struggle
mhm,
with sexual intrusive thoughts, right? Like a fear of, I remember in elementary school in my own journey, a fear of like I saw a kid's underwear and thinking, that's so bad and I shouldn't have done that and I must have done something sexual and going home and confessing to my family when I was in elementary school. And so I think you're raising a lot of awareness by speaking to this piece that it can happen very early on in someone's journey, especially the type
yep,
of things as well.
yeah. So that was like kind of middle school and got through middle school fine. And after middle school, I decided to transfer actually to a private um, high school for better like athletic and academic opportunities, which was good thing in hindsight, but also came with a lot of extra pressure just given that environment. Um, a lot of the pressure like I put on myself and just perfectionism around school and athletics and things like that. Um, but my freshman year of high school is really where things began to kind of take a turn for the worst. And so, like I said, academic pressure was high, and my OCD latched onto my kind of schoolwork pretty intensely. And so I remember my freshman year, I'd be up till like 2 in the morning, just going over like studying, going over my homework over and over again, and then having to wake up at 6 a.m., do it all over the next day, and then also playing three sports. It just got to be a lot, and I started struggling to meet my like basic needs. Um, began having a lot of panic attacks on a daily basis, but still, I really internalized them like all these struggles. I was very good at masking it. Um, I was like scared to open up, I think. Um,
Do you remember
not
what the
I
fear was? Like if I speak up about this, what that fear looked like or what it was? Because I bet it's pretty relatable.
Yeah, I think I was just worried about kind of being judged, and I thought the thoughts I was having, like I couldn't tell anyone.
Mm-hmm.
Like they're too taboo, too like intense that if I told anyone, they would think like, "Oh my gosh, like he's crazy, like he's losing it."
So just so much guilt and shame around it that
Yeah,
prevented you from doing anything in relation to speaking out, meaning that you just went longer without getting appropriate evidence-based care too.
Yeah. And I think too, a big thing was like playing sports. It's kind of like hard love sometimes. Like if you get hurt, there's like, oh, rub some dirt in it and like get back out there. And
Right.
that was kind of like the mentality I was in. So I kind of just like took that and almost applied it to my mental health in a way.
Yeah.
Recipe for disaster. And
How did family respond during this time? Like I'm assuming because they're the ones that know you through and through, they
yeah.
probably had some insight into something's off right now with Sean. How did they help or interact? Or oftentimes family members are doing everything they can, and the opposite of helping is what happens because it exasperates symptoms. What did it look like for you guys?
Yeah. I mean, like I said, I hit it really well from them. So
Yeah.
it was really hard for them to say, just like, because I would be isolating kind of in my room and I'll just be like, oh, I'm just working at homework on homework. And I don't really think they thought much of it. I will say they did know. I vividly remember the finals week of my freshman year is kind of where I kind of reached a breaking point and I was having panic attacks nonstop. And I remember going to my parents' room at like 2 in the morning. And I was like, I cannot get my mind to stop because it just like would not stop. I remember just like the stuff I was studying was just like racing through my head over and over again. I thought I had to memorize like every single little detail, and I just like could not sleep and
Yeah.
could
So
not
it's
slow
like
my
the
mind
just
down.
right OCD stuff coming up for you at
Yeah.
that point. Yeah. And
Yeah.
were
And
you still
that's,
dealing with the sexual intrusive thoughts at that time?
yeah. But I think that kind of schoolwork and perfectionism and just right kind of overshadowed that at that time.
Yeah. And how did your family respond when you told them something's wrong? I'm struggling. What did they do? I'm assuming if they didn't know it was OCD, they didn't know what to do.
Yeah. So about I didn't have an OCD diagnosis at this point. I had just generalized anxiety diagnosis and social anxiety, but not OCD yet. Luckily, well, not luckily, but there is people in my family who also struggle with anxiety. So, like my parents, my dad especially, was kind of able to recognize that, oh, this is anxiety.
Yeah.
Um, so they were kind of able to tell me like, oh, like you're experiencing like really intense anxiety. Um, and so it was a grind getting through that finals week of freshman year.
Hmm.
And honestly, looking back, this is kind of a bit of mistake on my end, but like I didn't reach out for the help. And after that freshman year ended, I was kind of just like, okay, school year's over. Like everything's good. Like everything will kind of work itself out. And that just wasn't the case. And
Yeah.
I mean, I always tell people like from the outside, like it looked like I was like happy. Like I got the perfect 4.0 GPA. I just like had to get made like two varsity teams. Like that summer, my soccer club team like won a national championship. Like I always tell people like from the outside I looked happy and like felt like I should have been happy. But
Right.
like on the like internally, like I was breaking down.
Yeah.
And
Suffering.
and so I kind of pushed that like under the rug, and then my sophomore year came around and that's when I really reached a breaking point. And I always tell people I lasted, I think it was about 2 weeks into my sophomore year of high school before I found myself in an inpatient mental health facility, just completely unfunctional, like uncontrollable panic, extremely suicidal.
Mhm. Yeah, and you bring up something that I think a lot of patients go through before they get the OCD diagnosis. What Sean was describing there, for those watching, we use the term white knuckling, right? So
Yeah.
he was doing everything he could in those moments to just survive and get schoolwork done because he cared about it and all of these things. And I think oftentimes we have this misconception of, oh, well, but Sean was successful. OCD helped him get a 4.0 or make two varsity teams, when in reality, that was not sustainable. And eventually, what I think I don't mean to give a sneak peek of about to happen, but like eventually the OCD worsens because we're not engaging in treatment, and it stops waxing and waning and gets to a point where we are completely unfunctional. And
Yep.
so it's so important to be as preventative as we can when we know the resources are there. Like a lot of us, like Sean and myself, even in my own journey, didn't know what was going on, and weren't preventative because we had no idea where to turn, which is why we do the advocacy work that we do now of raising awareness so that people can intervene with the appropriate treatment sooner, instead of having to get to this place that Sean, you're probably about to describe.
Yeah. And so I was 16 years old at the time, unable to go to school. Um, my sophomore year, I spent the next few months in and out of various inpatient facilities, different IOP programs, a whole bunch of psychiatrists and providers, and
Had you
re-
gotten an OCD diagnosis yet?
no.
Yeah, which is why.
Um, so yeah, just at that time, it was just generalized anxiety, social anxiety, and major depressive disorder. Um, but yeah, still no OCD diagnosis. And I mean, part of the reason for that is like I still didn't open up about those
Right,
things. And
right.
like I was opening up about like a little bit my depression and anxiety. So they're kind of able to diagnose that, but I like refused to open up about what I know now or like was OCD.
Yeah. Well, that's part of the reason, but also I think the other thing that comes to mind is there's a lot of clinicians that are
But
not
don't
informed
know.
on how to assess, right? And research shows that it's a little mixed. Some research shows like 12 years from the onset of symptoms before someone
Hmm.
receives an appropriate OCD diagnosis, and then some still shows 17 years, which is insane when you think about how long that means someone's going to be suffering before they get an intervention that gives them relief.
Yeah. And so in and out of these programs, like I was kind of half engaging in treatment, and obviously it wasn't the treatment I needed, so I wasn't seeing any results and kind of lost a lot of hope, to be honest. Completely withdrew like from my life, stopped talking to friends, like wasn't able to engage in like the sports and hobbies I once enjoyed. Was completely unable to go to school. I had to drop out of school my sophomore year. Um, there was an attempt to get me to go back for the spring semester, but that only lasted a few days before I found myself uh, unable to go to school and back isolated to my room. Um, and so, yeah, I really struggled with isolation in my room, like not taking care of myself, like not bathing, barely eating. Um, my parents had tried all these programs around us with kind of no results, and so they kind of made probably one of the toughest decisions they've ever made, and they decided to send me to a wilderness therapy program out in Utah. And so I would spend the next 4 months in the desert out at Utah in this wilderness therapy program. And I mean, I have mixed feelings about that experience, but I would be lying if said like it didn't save my life. Um, but I also always bring up that experience when telling my story because that's also the time that would kind of signify my like big uptick in OCD symptoms and kind of my shift in themes to more harm and contamination related fears.
Okay. So when you went to the wilderness program, OCD had morphed a little bit, is what you're saying?
Yeah,
Okay. And so the symptoms at that point were just more obvious.
yeah,
Got it. Okay.
yeah. Because I remember wilderness, as I'll kind of touch on here in a little bit, but wilderness is the first time my hands would crack and bleed.
Hmm.
And as we'll go into, like hand washing will become like over the next couple of years, kind of my most time consuming compulsion. Um, but wilderness was like the first time, like I remember like that's when it kind of transitioned over.
Got it. Okay, that makes sense. Yeah. A very unique way for wilderness to save your life, but
Yeah,
I understand that. Yeah, like that's the thing is OCD can totally morph, right? It can
yeah,
go from what you were experiencing before with the sexual intrusive thoughts and just right OCD that you were able to hide to, okay, now I'm doing all of this hand washing and these rituals that other people can see and I can get a diagnosis a little bit easier. Not that you didn't deserve to have a diagnosis when it was hidden with given the right questions.
yeah.
Yeah, I can see how wilderness saved you in that realm. So you were at wilderness all 4 months.
All 4 months. Yeah.
I'm assuming
Um,
OCD probably did not get better when
no,
you
Uh,
were
s-
back in
so
exposure.
I came home after those 4 months and was in like a better place, especially like depression wise, and was able to go back to school. Although this time it was a little different, a different school that was a little more suited to like support um me and just like my mental health struggles. Um, so that was going good. I felt like I was gaining some traction, and then the pandemic hit.
Hmm.
And so those contamination fears that were starting to come up in wilderness, when I got back home, I was like, okay, I can kind of like push these down and like get back to school. Like I'm in a better spot right now. And then the pandemic hit, and it was just like overnight, those contamination fears just became uncontrollable.
Yeah. So a
Um,
lot of white knuckling again that you had already had to go through
yep.
once, with OCD just doing this like looping of really, really bad. Okay, it's a little better. Really, really bad. Okay, it's a little better.
Yep.
Okay.
And so the pandemic hitting would like signify my real, like kind of starting to really snowball into the depths of OCD. And so I was terrified of getting my family members around me like sick and something terrible happening to them. And so I started like isolating myself to my room again a lot. And then started engaging in a lot of like cleaning rituals and bathing rituals and all those sort of things. Um, and I remember this went on for a few months and I still didn't understand what was happening and but I was like really struggling. So actually for the first time in my life, I went to my parents and I was like, I need help. Because all the previous times is them coming to me and be like, Sean, like you need help. But this was the first time like, no, like I need help and kind of want help. And so I started seeing this provider virtually. Um, and at first, it was just all still geared at my just generalized anxiety and social anxiety because I was
Yeah.
still so scared to open up about my OCD struggles. Um, but I vividly remember this day. I was in a telehealth appointment with her, and my like hands like showed on the Zoom screen, and my hands at that point were cracked, red, and bleeding. And she was like, "Wait a second, like what's kind of going on there?" And luckily for me, she was actually an OCD provider. Like that's the main disorder she treated, and this was through Penn. And she was actually led the OCD program at Penn,
Okay.
and that was the day I would get my OCD diagnosis. I was geez, probably 17 or 18 at the time.
Mhm. How did it
And
feel to get that diagnosis and to understand what OCD was?
yeah, I think I always tell people it was mixed emotions.
Yeah.
One part of it was like really relieving to know that there was a disorder, like a word that described what was going on
Yeah.
in my head. But I was also really scared because I knew that it was kind of like another hurdle I felt like I would have to overcome. And I kind of started learning about the treatment and I was terrified.
Yeah.
Um, so one part of me was very relieved that there was a name, a word for what was going on. But the other part was I knew that the journey ahead of me was going to be challenging.
Right. And so did you like as soon as she gave you the diagnosis, did you guys keep working together and did you start exposure with response prevention or what was the next step?
Yes, so I started ERP in the coming weeks after that diagnosis. But even then, like, so she diagnosed me with OCD, but I was able to open up about some thoughts or
Right.
some of my experiences going through, but I was still so scared to open about other parts. So she didn't realize how severe it was. And so we kind of started exposures. And honestly, when I reflect back, those exposures at that time were probably too intense for me at the beginning. And I was doing the exposures, but the response prevention piece was not there. And it,
Yeah, that no, I that's so important to say. I was just talking about this in a presentation earlier today. Response prevention means that we're preventing the response, right? So for those listening, we're talking about the word ERP, exposure with response prevention, gold standard of treatment for OCD. And when someone's engaging in exposure, they might be willing to touch a doorknob if they struggle with contamination OCD. But if they're just sitting here like this after touching that doorknob and just waiting until chance they get to wash their hands, they're not engaging in response prevention, right? And so
yep.
cross contaminating, leaning in would be full response prevention. And really, we have to start with a lot of education with the patient so that they know how to engage in exposure work successfully so that their anxiety goes down naturally. Sorry to interrupt. I just wanted to plug that real quick.
No, and like I have a story that's relatable to that is like, so she had me do an exposure where I was laying on the bathroom floor. And so I was in session like over Zoom like this and laying on the bathroom floor. And then I didn't fully understand the treatment and it felt so counterintuitive because all the treatment I had prior just for anxiety, the treatment provider was almost trying to like to have me almost not like get rid of that anxiety, but like in a way, yes. Versus ERP, now I was like intentionally trying to make myself anxious, and I'm like, this feels
Totally.
so wrong. And so I'd do these exposures like with her on Zoom, like laying on the bathroom floor, and as soon as I hung up the Zoom call, I was getting right in the shower.
Yeah.
And so I understood in a way that exposure piece, but the response prevention was like not there at all. I was just miserable because not engaging this response prevention, like I was just in this constant state of panic and compulsion, just keeping that cycle going.
When
And
you, it
so,
sounds like we're big on the people pleasing, right? So you were kind of telling
yeah,
that therapist whatever she needed to hear to feel like she was doing a good job. And so she
hmm
thought, oh, great, he's willing to do this. Awesome. When in reality, that was way too hard of an exposure for you, but you weren't able to speak up about it at that time.
yeah. And so it comes as no surprise that I didn't really see any progress. If
Right.
anything, it was kind of the opposite. So I was like, this is not working for me. Like I'm not ready. And so I kind of decided on my own to like stop treatment. Um, and it comes as no surprise that I only kind of snowballed further. Um, and so I always tell people the next 2, 3 years of my life are kind of a blur when I reflect on it, just because every day was pretty much the same day in and day out. Um, and so compulsions kept becoming more time consuming. And so for about 2, 3 years, I was probably spent what felt like every second I was awake compulsing. I was hand washing for up to 8 hours a day, showering up to 3 to 4, um, going through multiple things of Clorox wipes, Lysol spray, you name it. I was completely essentially housebound, stopped driving entirely due to hit and run fears. Couldn't go, didn't hang out with friends or really talk to anyone. Couldn't go on family vacations or family trips or eat dinner with the family. Like it was just kind of OCD consumed my whole life.
Was there a
Um,
part of your brain, Sean, that was like, well, I already tried the therapy everybody's been telling me, ERP,
yeah.
so that doesn't Like, because I think so many people think, oh, well, ERP just doesn't work for me, when in reality, they, just like you said earlier, weren't doing the right ERP at the
Right, ERP.
C or, one of those types of things. Did you have some of that stigma or that belief?
Oh, for sure. And I think I was kind of felt hopeless. I was like, well, they're saying this is the gold standard treatment, but like I tried it and it didn't work. Or like I felt like it didn't work for me. I wasn't reflecting now, like I wasn't doing really ERP. I was really just doing the E. Um, but yeah, I was like, what am I gonna do? Like this is I kind of accepted in a way that this is how I was gonna live the rest of my life.
Yeah. And so what was because I think we'll go back and we'll talk about, just because this is our family webinar too. And so I
Yeah.
want to talk about family accommodations and how that probably played a role as well. But
Hmm.
first, what was the pivot point? Because this went on for, you said 3 years. Is that what you had said?
Yeah, about 3 years. And it just continued to snowball. And
Yeah.
I really reached my breaking point and was candidly like kind of in a life or death situation just because I was really struggling just to like just meet my basic needs, just like food, water, sleep, and things like that. And I couldn't function anymore. And my family also couldn't function anymore just because how OCD not only took over my life, but also started really taking over my whole family's life and our home environment.
What did
And
it look like for family when, like in the day to day, you were washing your hands for hours and hours, showering for hours and hours? What was family doing during that time, given they were just trying to do the best they could with the information that they knew?
yeah, I mean, I think for me, like I wanted to have as least amount of contact with my family as possible.
Yeah.
So there's kind of like rules that like my OCD created that like if I was somewhere, like they couldn't be there. It was
Okay.
almost like I was living in a little bubble like inside our house
Yeah.
and like no one could touch that bubble.
Got it. Got it.
Um
And so they were avoiding, at this point, you probably didn't have much of a relationship with them because there was very little communication. Is that fair to say?
yeah, I mean I'd say like our my relationship with my family was all OCD.
Yeah. Yeah. Was there any, so like common family accommodations involve family cleaning things for individuals, answering reassurance questions, avoidance, we've talked about, family
Yeah.
avoiding touching or doing certain things for the sake of the patient, trying not to get them more anxious, helping with confessing, telling you it's going to be okay, anything like that they were doing as well?
Oh yeah. Um, Pretty much all of the above.
Yeah.
Because I vividly remember when I eventually went to treatment and they were meeting with a family therapist through the treatment, and it was probably about my second or third week into treatment. I came into the family therapist's office and they're like, okay, so me and your parents worked on like creating a list of like all the ways we've been accommodating you these past few years. And they pull up the list and it's like, I remember it's like a 5, 6 page Word document. And I'm like, oh,
Good to know. Good to know.
yeah. And there are things that like I didn't even realize.
Right. Right. Well, and that's the thing, right? Is that every parent, when I walk in, if I'm doing a family session that's space informed, which, for those watching now, space informed work is a great way for family members to have support on reducing accommodating behaviors for someone with OCD. A lot of clinicians do space informed work. If a patient's not ready to do ERP, the parents will start reducing accommodations that in turn kind of make the patient do some ERP because the family is no longer accommodating. But what I would say is that, your parents were doing, you know this better than anyone, the best they could with the information they knew at the time.
Yeah.
Anytime, it's human nature when we see our loved one struggling to run to them and make them feel better, right? But when it comes to OCD, we know that long term that just exacerbates symptoms. And so, if I always say, if you didn't go to school to be an OCD clinician that spent hours and hours on training, as a family member, you wouldn't know how not to accommodate. It's natural human nature. And so your poor parents were trying to care for you, and everybody needed the education that, oh yeah, this, because it feels difficult, right? Oh, you mean we're not going to
Yep.
run to Sean anymore and give him those accommodations? We're going to let him feel that anxiety. How challenging to see your kid do that. But we really engage in what's the long-term picture. And that's
Yep.
to give Sean his life back.
Yeah. And I remember too, this was probably in the probably a month before treatment, like because my parents started doing like their own research about OCD, and they kind of got wind of like what reassurance was and
Yeah.
accommodating. And I remember I was this one day I was like went to my dad and I was in panic and tears, and I was like, I need you to wipe down the surface because like I couldn't get myself to do it. And it usually would be like, yeah, like how do you want me to do it? And like I'd basically be telling him like how my OCD want to do it. And he was like that day he was just like, no. he
And
was like he was like basically like if you really want to clean it, like you're gonna like you have to clean it. But he was like, I'm no longer like doing that for you.
yeah. Yeah. And that alone is like a great example of your brain at that time then started to learn a new way to cope, right? Of,
Yeah.
oh, wait, this isn't going to happen or give me that temporary relief. So I've got to pivot and do something else. And that's where true behavioral change starts to take place.
Yeah, and I can't even imagine that like as a parent. Because obviously when my dad said that, like I kind of started like freaking out and like panicking and was obviously like really emotionally dysregulated and started like
Yeah.
I mean it wasn't me, it was driven by my OCD, but like yelling and
Right.
getting like intense. So I can't even imagine that like
Yeah.
as a parent. Um, but I would say to parents, like, if your kid or loved one like is doing that and like is kind of like yelling, like it's they don't want to do that, like it's not them, like it's their OCD.
Yeah, it's a good um, talking point there. That doesn't mean that they don't love you. It means that they're really struggling and
Hmm.
trying to figure out how to cope in a different way for the first time, maybe because this accommodation has been going on for so long.
Hmm.
Yeah. So, okay, family, the first step, family kind of started reducing their accommodating behaviors.
Hmm.
And what happened from there?
I mean, it was just out of control at that point, and as I mentioned, kind of that life or death situation. And my parents were doing their own research and started finding programs, and they're like, Sean, like I think like it's time, like you need help, like you are completely unfunctional and we can't handle this anymore. And I felt like I kind of owed it like to them and like to myself to like, okay, like I have to try to make a change here because I kind of recognized that what I was doing was no longer working.
Right. Right. And I
Um,
think you weren't getting relief, right? Like I always
no.
tell patients, especially if they're afraid of ERP, like because, well, one, oftentimes we're afraid of ERP because we don't know that it should entail a collaborative approach, right? Like a therapist isn't going to throw a scary exposure at you. They're going to work with you together to determine what you can and cannot handle and then do some of those exposures with you. But
Yep.
the other piece is I always like to say living with untreated OCD is so hard. Engaging in exposure with response prevention is also hard, but I would say living with untreated OCD is much, much harder, right? And
Yep.
I always point out, you've already done that. So if you
Yep.
do that, if you lived through that, you can definitely do the ERP side of things.
100%.
Yeah. So okay, you and family started looking for a higher level of care at that point.
Yep. And we were kind of pretty like desperate and frantically looking around, and there was all these wait lists and things like that. And luckily we found OCDI Texas. And you guys were able to take me in on relatively short notice actually. And it's probably like 2 weeks after. Um, I really remember that day, like walking. I remember the date. It was October 18th, 2022, when I walked into treatment. And I always tell people that was one of the scariest, hardest days of my life, but it
Yeah.
also signified the real beginning of my treatment journey and the real beginning of me starting to get my life back.
Mhm. Yeah, yeah. And so that scary moment, how long into being here at OCD Institute, how long did it take? Well, before I do that, real quick, so you guys, since we're coming up on the last 15 minutes, please drop your questions into the chat that I'll start asking Sean here
Hmm.
shortly. Or a couple of them seem clinical, so I might answer those really quick. But yeah, going back to kind of what Sean and I were talking about, at what point in treatment did you recognize this is where I need to be, or this is working? Because I'm assuming when you first got here, you were still terrified. You had no idea. You
Terrified.
tried ERP before.
Yeah, vividly remember too, like the first 2 weeks, like spam calling my parents
Yeah.
and being like, this isn't gonna work out for me. Like, this is too scary. Like, I need to come back home. And I'm forever grateful for this. Like, my parents also took on that like tough love stance again. They're like, no, Sean, like you need to be there. Like, you kind of owe it to yourself to like try to make the change. Um, and so like I was like, I want to come home. They're like, you're not coming home. um, and so the first couple of weeks were extremely hard. Um, but I would say after a few weeks, I started to like engage in the treatment a little more and started to see the progress. And I mean, uh, my treatment journey, like everyone's else, like wasn't linear. Like it was filled up and ups and downs, but starting to see that progress, I was like, oh, this is possible.
Yeah. Yeah. And so you started leaning into more exposures, getting like, was there a point where you remembered getting some like longer term relief that wasn't coming from a like a quick fix compulsion?
Um, Nothing comes to mind of like an exact
Sure.
moment.
Sure.
I think just like kind of doing treatment day in and day out, just like kind of one day I was like, oh, like this is kind of working. And I remember my therapist kind of had me like reflect on like what I've done so far in treatment and the progress I made. And I was like, oh, like maybe I am like getting better and not giving myself enough credit for that. So that kind
One
of put things in perspective.
One of my favorite questions to ask people is like once they're further on in treatment and we know they're making some progress is like, oh, was there a point where you weren't willing to do this in treatment? Right? Like, because you probably saw like if the therapist that you were working with said, I need you to touch this and then touch that day one, you would have been like, heck no. And
Yeah, I remember seeing my treatment plan and like the like higher stuff on my treatment plan. I was like, there's no way. And I
yeah.
remember telling my therapist, like, yeah, maybe we'll get through like these lower level stuff, but I was like, there's not a chance I get to that stuff. Like, there's just no way I ever do that.
And so your therapist was like, well, let's just see. Let's just like wait and see. And then
Yeah.
that day that there's usually like this moment where you really reflect back and you're like, I'm doing all the things. Like I'm doing all the things that I never thought I'd be able to do.
Yeah.
Okay. Yeah, huge. And so you started to get life back. And could you talk a little bit about like what family involvement looked like while you were in residential?
Yeah. So family, obviously, they were had their family side of the treatment, getting it's like their psychoeducation about like OCD and treatment and how they could better support me. And so slowly but surely that kind of relationship kind of shifted. And over time, it became less about my OCD and a lot more just like life stuff.
Yeah, like my favorite thing when I'm doing family therapy with the family is like when they have a life problem that has nothing to do with OCD and they don't realize like how big of a win that is,
Yeah.
right? Like I'm so tired of you um watching TV for so long and like not giving other people the remote. I'm like, this is awesome. I love that
Yeah.
we're talking about this.
Yeah.
Yeah, that's a huge win. Well, I have a good question from someone in our
Okay.
audience that submitted anonymously. Did you ever fear that doing an exposure would make everything more dirty or worse? And if so, how did you overcome that?
Yes, 100%. And I think for me with contamination OCD, like I had these like safe places and these safe areas, and I was like, that can never get dirty. And I think for me, it kind of took me realizing with the help of my therapist that like the more I tried to keep these things safe and clean and not dirty, the more stuck I was going to be.
Mm,
And I would be trying to protect those for the rest of my life and like never feel fully content that those things were fully clean. And so my therapist always repeated this line like to me, like, Sean, if everything's contaminated, like nothing's contaminated.
I
And
love
I was like, no, you're wrong, like at first. But then when I really kind of leaned into that and like allowed these safe spaces to get contaminated and dirty, it was really hard at first, but it was also one of the most freeing experiences in the world.
yeah.
Because I was like, well, it's already contaminated. So, like, there's nothing I can do now. Like, I might as well just go live my life now.
Yeah. Yeah. Very
So
well said.
there's nothing left to protect.
OCD to latch onto.
Yep.
Yeah, yeah. A few of you are asking if this webinar will be available after the fact. Yes, it will be on the OCDI Texas website. So you can watch all of our webinars live there. Please make sure to go and check those out in addition to this one with Sean. Sean, next question. You mentioned that at the beginning you elected not to share some of your thoughts with the therapist. Looking back, is there anything that therapists could have asked you or done to help you feel safer about being able to open up with some of those intrusive thoughts?
Yeah. I mean, I think at the start, I lacked psychoeducation. And kind of as you mentioned, I was very much like a people pleaser and kind of just like said what I needed to say to like get through the sessions, and kind of played it off that I had a better understanding of OCD than what I did. So I think from the clinician side of things, just really learning more about like OCD and like all the subtypes and know that that's like a part of OCD. Um, because like even if I didn't like have those subtypes necessarily, just like hearing about them, especially like all the like taboo ones. Um, I think it would have helped me feel more comfortable opening up.
Yeah, yeah. I love that you say that because I 100% agree with you. Just even if a clinician pulls out the Yale Brown obsessive compulsive checklist, right? So this
Yep.
is available online for those clinicians that might be watching today, the Y box, in short, symptom checklist. Even just like going through that with the patient and then them seeing, oh my goodness, that symptom is listed on a piece of paper for you to put a check mark next to. I thought I was the only one, right? The
Hmm.
relief that comes from being just like you said, Sean, being able to see that, oh, there's a diagnosis. If the clinician would have asked some of those questions, you might have been more willing, I'm assuming, to say yes if they were as specific
Yeah.
as that.
And I think a big thing for me in opening up too was also meeting other people with
Yeah,
OCD. Because like before going to treatment, I hadn't met a single person with OCD or like outwardly told me that they had OCD. So just being in that environment and just hearing from other people about their own OCD, I was like, oh, like number one, I'm not alone.
yeah,
Like other people are going through the same experience I'm going through. And like number two, like I'm not crazy.
right.
And that what I'm experiencing is OCD and kind of feeling not alone kind of helped me open up a little bit more as well.
Yeah, isolation is one of the biggest feeders of mental illness across the board,
Mhm.
OCD included. But Natalia, you asked about the relationship between OCD and trauma. And just real quickly, I'm going to speak to that. If someone has a diagnosis of PTSD, we will want to first get the appropriate treatment for that. It does often involve exposure therapy, like prolonged exposure for trauma. Cognitive processing therapy, EMDR, are all treatment modalities utilized for trauma. If you're experiencing anxiety, heightened anxiety that's coming from the exposure side of things or from the OCD side of things, you will want to engage in exposure therapy. And I think just it's nice to have a provider that is familiar with trauma, that maybe has some cognitive processing background, so that you guys can touch on that. But oftentimes I think we're confusing, oh, this anxiety is coming from my OCD for trauma, because we don't want to feel the anxiety at all. So it's just really good to assess to make sure you're not meeting diagnostic criteria for PTSD at that time, or more severe trauma that needs to be addressed before you're doing ERP for OCD. Next question for Sean. Do you still engage in some OCD behaviors sometimes, and how do you watch out for that or keep yourself accountable?
Yeah, I would say overall, like my OCD is very well managed now. I think I always tell people like from what I was at my worst, like most days I don't even really think about OCD. Like I still have obviously some thoughts. I don't even really like calling them like intrusive thoughts anymore, just because they're really not that intrusive. Like they just feel like they're just another thought. And I, through treatment, I can kind of recognize that those are just thoughts. And if they are like intense, like they're just thoughts. And knowing that I have control over my response to those thoughts. And that's the biggest thing because once I accepted, like, I can't control whether I'm having these thoughts or not, but I can control my response to those thoughts and my behavior. Um, and knowing like what I've been through and through treatment, that if I don't respond to those thoughts, like how my OCD wants me to, like they kind of almost just like go away.
Yeah, yeah, beautifully said. I think to add to that, it's similar to kind of saying like I stopped trying to control the anxiety and instead started trying to control my behavioral response, right? I think
Yep.
we get so wrapped up in OCD when we're trying to fix the anxiety when actually that's what's making the anxiety worse. Or like Sean mentioned, trying to get rid of the thoughts, and the thoughts were coming on stronger versus like, yeah, I'm not going to judge those thoughts. They're going to be there. And I'm going to engage in the treatment approach of getting my schoolwork done, of touching these contaminated surfaces, whatever it might look like at that time, to work towards freedom without responding to the anxiety like it's an emergency anymore. So,
Yeah. And that was a big thing for me, psychoeducation wise, because I went into treatment being like, oh, they're going to help me like stop these thoughts.
yeah,
But
yeah,
then like learning about treatment and really accepting that like I don't have really any control over my thoughts, but
right.
knowing that I have control over that response is that kind of mental like shift kind of changed everything. And that's when I
Yeah.
really started to see those gains in treatment.
Yeah. And the secret to that is that's like what actually makes the thoughts get milder down the road, anyways.
Hmm. Yep.
Yeah, beautiful. Well, okay, I'm going to ask one more submitted question, and then I'm going to end with just one more question that I have for you. Um,
Okay.
this one, how much did the self-help side of ERP work for you? Like reading books on ERP, continuing to do that versus actually engaging in psychotherapy?
Um, Honestly, I didn't really do a lot of like self-help.
Yeah. Yeah.
Um, it was more so working with my treatment team. I will say like one thing that helped me kind of at the start of treatment and leading into treatment was kind of hearing other people's recovery stories and just knowing that it is possible and that there is hope. Um, But in terms of self-help, especially like leading into treatment, like I didn't really do much.
Yeah, yeah. I'll speak to that too and just say there's nothing like the accountability of someone else, to kind of know, okay, next session they're going to check in and they are going to ask me if I did my ERP homework, especially if you're new to OCD treatment. I know that there are difficulties out there with getting resources and things like that. This individual also mentioned that it's hard to find a therapist locally. Sometimes looking and seeing if there's a SIPACT provider that's licensed in many different states. Most of those SIPACT providers really like to help people in rural areas, so that they can get that treatment virtually. But also, if you're looking at intensive treatment like Sean, you had to travel for residential level of care.
Yeah.
Usually, when it's specialized, and you're doing intensive, it's not most commonly in your neighborhood, because there aren't enough OCD providers and clinics out there that do that specialized work. My last question for you, Sean, is a very basic, typical. If you could tell any family or individual that's on the fence about getting treatment or support or help, what would you tell them?
Yeah, I would start by saying that number one, you're not alone and that there's hope out there. Um, I stand by like my treatment journey and going through ERP was probably one of the hardest things I've ever had to do in my life, but I also wouldn't change it for the world. And like if you had to tell me I had to do it like all over again to get to the point I am now, like I would, in a heartbeat. So there's so much help and support out there, and it's not gonna lie to you, like it's not gonna be the easiest journey, but it's a journey that gets you your life back and freedom from OCD, where you can live by your values and live a fulfilling life that you want to live, where OCD doesn't have that control.
Yeah, very well said. That was beautiful, absolutely beautiful. We cannot thank you enough for being here, Sean. This message of hope is going to help so many, or is helping so many already that are here joined with us live. Just like you said, what helped you so much was realizing that you weren't alone. And so by sharing and spreading this message, you're helping others realize that same exact thing and hopefully seek out support. We did have a few of you ask questions about treatment at OCDI. Happy to answer those. Please call our admissions line and they will answer any of those questions at 832-900-8687. You can also go out on our website at ocditexas.com. We have a chat there, or you can look at some of the resources that are just posted, but we'd love to speak with you. Sean, thank you so, so much for being here. It was great to talk with you.
Yeah, it was great. Thank you so much for having me.
Absolutely. All right, everyone. We will see you next time.
Bye.